Hi everyone. So this is the third part of the pathology images section, and the first image is of flea bitten kidney. Flea bitten kidney seen in following condition. It is Wegener's granulomatosis in the post streptococcal glomerulonephritis and in the polyarteritis nodosa, in the subacute bacterial endocarditis, and the most important, it is seen in the malignant hypertension. So these 4 5 entities we need to remember, and the most importantly which is asked is linked is malignant hypertension. Then the next image is of atypical lung carcinoid. So how we will differentiate between atypical and typical lung carcinoid? It will be on the basis of the history. In the question, it will be given that whether how many mitoses are there. If more than two mitoses and necrosis is present, then it is atypical carcinoid. Then next image is of myocardial infarction. After the myocardial infarction, the heart tissue is damaged. The muscles of the heart are damaged and contraction band necrosis. Contraction band necrosis occurs. Wavy pink lines are seen. Wavy pink lines are seen as seen in the image. So these changes are typically observed 6 hours after the MI. Up to 6 hours, contraction band necrosis is seen. Then next image is of plasma cells. The classical feature of plasma cells, how we will identify them on peripheral smear, is that they are having clock face nuclei. The nuclei is looking like clock, like this one, clock like nuclei can be seen. Then next image is of hyaline cast. How we will identify hyaline cast? The hyaline cast are pinkish in color, like this one. This one is pinkish in color. Hyaline cast are present in the urine and these are pass positive. They stain positively with the pass stains. Then this is a gross specimen of cryptococcosis. Accumulation of organism in the subarachnoid space causes cystic change. So when the organism, the cryptococcus accumulates in the subarachnoid space, it causes cystic changes, and the classical appearance which we get are soap bubble appearance. It is looking like soap bubbles. Then this is the cytology, CSF cytology of Cryptococcus. Cryptococcus yeast forms with a thick capsule are seen and narrow necked budding is seen. Budding will be seen like this, budding is occurring, and yeast forms will be seen with thick capsule. Then this is image of Pearl's iron stain. Pearl's iron stain, or also known as Prussian blue stain, and it stains the iron bluish in color. So basically, in which conditions we will see this Pearl's iron stain or Prussian blue stain will be positive in hemochromatosis. And this is image of giardiasis duodenum. Giardiasis duodenum, we can see the organisms and ulcers in the intestine, and how we will identify in the question the history of the traveler having diarrhea or vomiting, that is GI illness will be given, and we need to identify the organism, so it will be giardiasis. Next is peripheral blood smear. On the peripheral blood smear, platelet is seen like this, small dots, then band shaped cells are seen, eosinophils with eosinophilic granules will be seen. Basophils will be bluish in color, bluish granules. Basophilic granules and eosinophilic granules will be pinkish in color. Then neutrophil with many lobes will be seen. Lymphocytes with the large nuclei and monocyte, the largest cell, will be seen. And RBC with the central pallor. So this is the basic slide that how we identify the different cells on the peripheral smear. Then this is image of cold autoimmune hemolytic anemia. In this, the cold autoimmune hemolytic anemia, basically we will be having the clumping of the RBC. Then next is the slide of fat embolism. How will identify fat appears clear on the histological section. So fat embolism, these clear spaces are due to fat embolism. Then this is Gordon's and Sweet stain for reticulin. Gordon and Sweet stain, we need to identify that reticulin appears black on the staining, and the cytoplasm will appear light red and the nuclei will appear red. Basically, it is used for liver, spleen, lymph nodes. To detect the cirrhosis and other changes in the liver, we use this stain. So reticulin stain is an argyrophilic, that is silver. It is a type of silver stain, and it stains the reticulin. Reticulin will be appearing the black. Only one thing we need to remember, that reticulin will appear black on Gordon and Sweet stain. Then this next image is of lymph node. Lymph node, the three layers or three zones we need to remember. See, we are starting from the outside. Capsule is there, then subcapsular sinus will be there. And in the center of the lymph node, we have the germinal center. Then surrounding will be mental zone. And surrounding that will be marginal zone. So we need to remember the innermost is germinal center, then is mental zone, and then is marginal zone. Marginal zone is also known as interfollicular zone, between the two lymphoid follicles. This zone will be marginal zone. The mental zone will be appearing dark and germinal center will be lighter compared to the mental zone. Then this is slide of EVV positive DLBCL. Basically, from this slide, we can't identify as such that it is DLBCL. In the history, it will be given that aggressive malignant lymphoma is there in the child or in the adult. So KI index will be given and mitosis will be given, that high mitosis rate. From that, we will identify that it is diffuse large B cell lymphoma. This is image of light chain deposition disease, has granular amorphous deposits on the endothelial aspect of the glomeruli. Basically, this is image of glomerulus, and in the glomerulus light chain deposits will be seen, and this is seen in the cases of multiple myeloma. Light chain deposits on the endothelial surface. Then this is image of multiple myeloma. In the multiple myeloma, the myeloma cells will be present. Then next is amyloid deposits. Amyloid deposits means amyloid, that is light chain amyloids, are deposited in the kidneys in the multiple myeloma. That leads to renal failure. These are amyloid deposit. Then this is the image of membranous nephropathy. Basically, this is fluorescent imaging, and in this the membrane is appearing greenish. So it is membranous nephropathy. The deposits are along the membrane, and that gives it fluorescent appearance. The immune complexes deposited along the membrane are responsible for this appearance. Then this is electron microscopy. In the electron microscopy, the darker electron dense immune deposits are seen scattered within the thickened basement membrane. These spikes seen with the silver stain represent the intervening matrix between the deposits. Okay, so basically in the membranous we were seeing the fluorescence along the membrane, and in the electron microscopy we will be seeing the deposits in the basement membrane zone. These are the deposits which are present in basement membrane zone. And the classical appearance is spike and dome, and spikes are due to intervening matrix. Then this is nodular glomerulosclerosis. These nodules are present in the glomeruli. Nodules are due to diabetes mellitus. Pink hyaline material are deposited in the glomerular capillary loops in the diabetes, and these are known as Kimmelstein-Wilson lesions. Kimmelstein-Wilson lesion, and this is due to marked increase in mesangial matrix as a result of non-enzymatic glycosylation of protein. This is a type of one form of chronic kidney disease. So classical lesions which are seen in diabetes mellitus CKD is Kimmelstein-Wilson nodules. Then this is lung photomicrograph, and the history will be given that person ingested foreign body and the lung specimen is taken, person died due to choking, then it will be vegetative matter aspiration pneumonia. Basically, in this slide, vegetative matter will be present in the lung tissue. That will lead to granuloma formation. So that's all about the third part of the pathology images. Some images are left. We will be discussing in the next part of this pathology images videos. If you like my videos and find it helpful, then please do like and subscribe my channel. Thank you.